The World Health Organization has urged local government units to tighten their health protocols, for these remain crucial in fighting the pandemic. It also told the Philippine government to fast-track inoculation programs to reduce the number of severe cases and even deaths. Karen Villanda reports.
Despite the increasing number of COVID-19 cases over the past few days that reach 3,000 cases a day, the World Health Organization said this will not yet be considered a second wave.
If you're talking of a second wave, we should have seen a complete flattening of the curve. And in the case of NCR, we didn't see that kind of flattening.
Instead, in this situation, government must intensify vaccination to help bring down the number of severe cases and fatalities based on the experience of other countries. On the prioritization program of Department of Health, groups listed in A1 and A2 must be inoculated first, or the healthcare workers and senior citizens, before moving toward the other groups, such as the persons with comorbidities, uniformed personnel, and the indigent population, to be followed by teachers, social workers, government employees, other essential workers, up to the overseas Filipino workers. According to the WHO, around 4.5 million doses of AstraZeneca vaccine will arrive in the country by the last week of April or May. But the DOH has said we must not be complacent. Instead, we must continue to follow the minimum health protocols. In Quezon City, residents are either not properly wearing their face masks and face shields are placed over their heads. On public transportation, passengers are even eating inside and removing their face masks. Aside from early detection, isolation, and quarantine, the WHO advised the LGUs to have a uniform set of protocols while reopening the economy.
Although we are now detecting clustering of cases in some cities, we are very closely looking whether it's just limited to these cities, knowing the very nature of the way people travel between cities for work, for business.
Karen Villanda for the Nation.